Thank you for taking the time to watch this short PowerPoint presentation. By the end of this presentation, you'll be able to state the importance of infection control and explain 3 ways you can help reduce the spread of germs in the school environment. Why is infection control important? First of all, it reduces the spread of germs that can cause illness among students and staff. It also reduces the number of students and staff that are absent due to infectious illnesses. Although there are several ways you can help in preventing the spread of germs, the 3 areas we're going to cover in this PowerPoint are hand washing, following the correct diapering procedure, and maintaining a clean and sanitary environment. Because hands are warm, moist parts of the body that come into contact with germs that can cause illness, hand washing is the single most effective way to prevent the spread of infections. Remember, caregivers who teach and model good hand washing can reduce illness in schools. Wearing disposable gloves is not a substitute for hand washing. Hand washing should include thoroughly washing hands with soap and warm running water for 15 to 20 seconds and drying with a paper towel. Friction is an important step in the hand washing procedure. Another way you can help to control the spread of infection is to know the 5 phases of the diapering procedure and follow them. The 5 phases include preparation, the dirty phase, the clean phase, cleanup, and communication. The first phase is preparation. During this phase, staff need to thoroughly wash their hands using the techniques stated earlier. Next, supplies need to be assembled so they are in easy reach. Supplies may include a clean disposable diaper, disposable wipes or paper towels, clean paper, a blue chucks pad, gloves, and possibly ointment, cotton swabs, or clean clothes. Once supplies are collected, you will then cover the diapering surface with the clean paper and blue chucks pad. The paper is placed on the top half of the diapering surface, while the blue chucks pad is placed on the bottom. Paper needs to cover the entire length of the child. Make sure you have clean paper within reach. Next, you will put on your gloves. The next phase is the dirty phase. During this phase, you will place the child on the diapering surface, making sure you keep one hand on the child at all times. Next, you will remove the child's clothing and set any soiled clothing to the side. Now you can remove the soiled diaper, making sure to roll the diaper inward and place it in a plastic bag. You will then clean the diaper area of the child, remembering to clean from front to back and using only one wipe per wipe. You should use the student's own wipes, or you can use the 3 paper towel method. Soap, rinse, and dry. The third phase is the clean phase. If during this phase you notice the blue pad is soiled, fold it up from the outside in and dispose of it in the garbage can and place a clean pad under the child. Diaper and dress the child, and then thoroughly wash both the child's and provider's hands, following the technique listed above. After this, the child may return to the classroom. During the cleanup phase, the plastic bag, table paper, and blue pad are disposed of in the waste container. If clothes are soiled, put them in a plastic bag without rinsing for the parent or guardian to take home. Clean and disinfect the diapering surface and all surfaces touched with cleaning solution provided at the changing stations. When done, thoroughly wash your hands once again. Make sure you report the diaper change to the parent, especially if there is an unusual odor, color, frequency, or consistency to the stool, or if you notice a rash. Communication can take place via email, phone, or paper reports. When diapering, always follow the safety procedures and never leave a child unattended. All body fluids should be treated as infectious, so diapers are to be changed only in designated areas. Soiled diapers are placed in a covered waste container, and a custodian should be notified so it can be removed from the area. Do not allow toys, blankets, or chew toys in the diapering area because they can become easily soiled or contaminated. Also, remember the importance of good body mechanics, especially when changing larger or older children. Appropriate bending and lifting techniques should be used to prevent injury to yourself and others. Another way to reduce the spread of germs is through cleaning, sanitizing, and disinfecting the environment around us. Cleaning is a process where soap and water is used to remove dirt, debris, and many germs. Sanitizing is a chemical process that reduces the number of germs on a particular surface. Sanitizing is usually used on food contact surfaces or mouth, toys, or objects. Disinfecting is also a chemical process, but it destroys germs on surfaces. When you are cleaning, sanitizing, and disinfecting, always follow the proper cleaning and disinfecting procedures, whether or not the area is soiled. Germs can live on any surface or items that do not even look dirty. Also, remember, disease-causing germs can be present in all body fluids. Children who do not show signs of illness may be just as infectious as those who do. You should wear non-latex disposable gloves when handling blood or items that are soiled by blood or body fluids. Other times gloves need to be worn are to cover open cuts and sores, when cleaning bathrooms, diapering areas, or any areas that are contaminated with urine, vomit, or stool. And remember to always wash your hands immediately after your gloves are removed. One last thing to keep in mind is the safety of children. Always store cleaning products safely out of reach. Remember, we can all lessen the harmful effects of germs by washing our hands, following the correct diapering procedures, and maintaining a clean and sanitary environment. Our goal is to keep kids healthy and learning, and keep staff healthy and teaching. Please watch the following short video and answer the questionnaire that follows. Thanks for your time. We appreciate your help in keeping our students safe.